Thank you for joining us this afternoon for another in our product demonstration series, Immunization Management with SNAP and SNAP Imm Link. I'm Bill O'Malley, a Strategic Account Executive here at PSNI. I'll be moderating today. If you have any questions, please enter them into the question box, and we're going to address as many as possible at the end of the webinar. Any we can't reach will receive an email response. Our presenter today is Mark Patterson. Mark is the newest Strategic Account Executive here at PSNI. He brings with him over a decade of experience working with K-12 schools and districts nationwide, with a focus on professional development and staff training. Mark is passionate about the work of the school nurse and believes he can't help solve a customer's problems until he listens first and understands their needs fully. This approach has led to building many successful long-term partnerships with schools and districts across the country. And with that, I'll turn it over to Mark.
Thanks, Bill, for the introduction, and thanks for everyone who's taken time out of their busy schedule to attend today. We know this is a busy time of year and your time's really valuable. So, again, as Bill mentioned, my name is Mark Patterson, one of the Strategic Account Executives here at PSNI. And I'm really excited to chat with you today about immunization management using SNAP and the SNAP Imm Link. Here we've been hearing increasing a level of conversation around immunization management, and not just in relation to COVID. The past year and a half, as you know, have presented school nurses with significant challenges in terms of maintaining the health, safety, and wellness of our school communities. As we start to move into the summer, we know you're already wrestling with how to get your students caught up on missed vaccinations, and I was also proactively handling vaccinations from a risk management perspective. And so this is really going to be the focus of today's webinar. Now, for the nurses currently in attendance that you're using SNAP, my goal is that you're going to find some new ways in which you can use our software more comprehensively and also gain a deeper understanding of what it is that we do behind the scenes. Not just to save you hours of work, but oftentimes weeks worth of work each year. Now, for those of you who are checking us out, maybe for the first time, my goal is that you have a true sense of what sets SNAP apart from any other EHR or SIS and why we're so passionate about the work we do for the school nurse. To help with that, we brought in a couple of panelists who will provide some insight, and I know whose perspective you're really going to appreciate. So as we start to talk about immunizations, I just want to highlight that during the past year and a half where COVID-19 has basically had and continues to have an effect on school attendance, routine immunizations have dropped off significantly. A recent report from the CDC showed an estimated 14% decrease in immunizations, for all students. Measles in particular, that vaccination has dropped off at an estimated 20%. Now, in 2019, just prior to COVID, the number of measles cases in the United States hit a 23-year high. So when you pause and kind of think about all of these conditions and complications along with COVID, it really makes reopening schools a bit of a challenge. Now, earlier this year in March, the CDC issued a Help Kids Safe Return to School statement regarding getting kids caught up on recommended vaccines. The recommendation should be no surprise to most of us here, but they do highlight the critical role that vaccinations will play in terms of the overall health of the school population. They ask school nurses to communicate immunization requirements with families, follow up with students who are not in compliance, as well as to utilize their state immunization information system to notify families where children have fallen behind on their vaccinations. So in order to ensure that nurses are equipped to meet these challenges, they really require tools at their disposal that are designed with their needs in mind, that save them time and save work when it comes to the monumental task of managing student immunization. And this includes communicating with parents and staff and administration as appropriate. So this is where our immunization piece really shines, and I think you're going to appreciate this. What you're seeing on screen is our electronic health record, and it's been used by nurses for years to ensure student compliance. Our Imm Link add-on, which I'll get to in a little bit, enhances our ability to track immunizations by linking directly with state registries where available, further ensuring that student data is accurate and as up-to-date as possible. Now on this immunization tab, you can see it's a very clean and straightforward document. In the lower left-hand corner, you see a compliance button, and I'm going to ask you to look at the sync button, but put that in the back of your mind for a second. We'll get to that in a minute. When nurse clicks on the compliance button, this is what you're going to see, and this is what really differentiates us from a standard SIS module. And it really starts with a high level of accuracy when it comes to immunization compliance. We have here at SNAP have the most accurate of all immunization compliance pieces of any EHR. Our software is able to recognize live vaccines and combination vaccines. And our nurse informatics team works year-round to ensure that our state-specific rule sets are constantly up to date. So in just 1 minute, I'm going to introduce you to our first panelist, which is Terry Hamlin, our VP of Nursing Informatics, and she's going to be able to share some insights into this particular aspect of our software. Now, before I do that, I just would like to shine a little bit of a light on the fact that PSNI is the only EHR company that employs nurses full-time as a standard business practice. We truly say and we live the fact that our software is designed for nurses by school nurses. Our nurse team works with the engineers during development to ensure that our software follows the workflow of the school nurse. And our nurses are part of our technical support team and training team. And where the rubber meets the road, what this really means for you is that when you have a question on a complex immunization requirement and you need to pick up the phone or turn to our live chat support team, you have that opportunity to speak directly to a school nurse. And this makes a huge difference in how the software works for you. So with that said, I will introduce Terry. Terry has worked in health informatics for more than 20 years. She's also worked as a nurse in a variety of settings with her last clinical experience in school nursing. She started with PSNI in 2000 and has been the health informatics lead since then, working directly with program developers to collaborate on the design, content, and workflow of the SNAP Health Center. She engages with state and federal organizations regularly to ensure that school EHRs are part of the HIT conversation. And she keeps abreast of upcoming changes to state and federal regulations and recommendations that would potentially impact the design, development, and maintenance of PSNI products. So with that, I just want to say thank you. Welcome, Terry. Glad to have you here with me.
Thank you, Mark, for that warm welcome, and I'm glad to be here.
My pleasure. So my first question, I thought I'd just start by asking you to talk a little bit about how our software, and your team in particular, help nurses manage immunizations as a whole. And I'm thinking particularly about the rule sets that I kind of mentioned, these things that are a little bit behind the scenes. They save the nurses a lot of time, but would love to hear from you on that.
Sure. So basically, we research every year whether the state setups have been updated. And as you can see here, this is one of the screens we use to actually set up the rules. This is what's done behind the scenes, and then you will import them into your software. But basically, we can set up all our rules based on your state regulation with the incorporation of ACIP recommendations that are applicable to your state, so that students in progress will not come up non-compliant until they actually need their next dose, so that you're not sending a child back to the doctor before they are actually due for their vaccine. So for example, there's a screen here where it's showing the hepatitis B vaccine. We not only look at the interval between the first dose and the second dose and the third dose, we're also looking at an interval between the first dose and the third dose. And every state is different regarding what they require, but we can look at intervals, we can look at minimum ages, we can look at the date they were born, we can look at the date they were enrolled into a school. It all depends on what your state regulation is, and it's all in combination, any combination of those different parameters, and those are just a few, are what's incorporated into the setup.
That's great, and I kind of want to call out to note, we're looking at this screenshot here, and this is something that nurses may never see in their daily use of SNAP. Again, this is a kind of a behind-the-scenes look at what we're doing of saving that pencil and paper work that they've got to do to match up dates and stuff that they would have to do by hand. We've gone ahead and done that. And I remember a couple of weeks ago we were talking, Terry, and you shared a story with me about a lead nurse who called in with a compliance issue, and it kind of pertained to this. Could you share that a little bit with us quickly?
Sure. I remember exactly what that conversation was about. We had a nurse who had been audited by her regional immunization program, and they had found her audit. She failed for about 4 or 5 different students, and I guess they were pretty rough with her regarding failing that audit. So she called us to find out why SNAP was saying the children were compliant when the auditor was saying they were not. And this has happened in the past with other schools, and whenever there is a question as to how the compliance is calculating, we always call the state level of the immunization program, which is exactly what I did to ensure that what we had set up was correct. And long story short, the regional auditor was wrong and they were interpreting their regulations incorrectly, and SNAP was correct. And we will do that if there's any question as to the interpretation of a law, whether we are questioning the interpretation or whether a school nurse is calling and their interpretation may be different than what we have put in. We always verify with the state level of the immunization program because they are ultimately the ones that are going to say what the regulation is. So, as I said, this has happened in more than one state. That is just one example where we work on behalf of the school nurses to make sure not only the state regulations are correct, but that the ACIP recommendations are correct. We communicate directly with the CDC, again, asking questions if we feel they haven't really covered everything. And they've actually changed some of the recommendations to be more specific over time. So yeah, we always work on behalf of the school nurses to make sure that these are correct and will correct them quickly if there is any issues.
Awesome, that's great. So I want to switch and talk about reporting functionality and maybe even put a little bit of a spin and focus on COVID, because that's going to be top of mind for a lot of school nurses. Now I know you shared with me that it's very, very unlikely that COVID vaccinations are going to become mandatory even as we move into fall and back to school. However, using SNAP, and there's hundreds of reports to use, but using SNAP, how could a school nurse determine which students are at risk if exposed to COVID?
Yep, you're right. There are a few ways you can do that, but I'm going to show you one of the easiest ways that's already built into your software. This past winter, when the COVID vaccines became available, we did add them to all our setups. So if you've imported those setups, you should have COVID vaccines listed in your SNAP program. And basically, you would run a vaccine summary report. Again, this is a presentation report that is already in SNAP. It allows you to run reports of anyone who has had 0 doses of any COVID vaccine, so it's based on the disease, who's had 1 dose, who's had 2 doses, and basically, even though it's not required in the school, you will get a list of every student who has had the specified number of doses. You can even run this report based on a grade level or by teacher. So say a child in the classroom had COVID and they're in an age group where, sorry about that, they're in an age group where they could get the vaccine, then you can find out which children didn't. So again, this is already built into SNAP, and we've actually created a help article for it on our customer portal so that you can download the instructions on how to get this particular report.
Excellent, excellent. Thanks. And I think this is going to be very handy for the school nurses as they start to think about that reopening in the fall. And I know they already are. So I want to switch it up, and I said we're going to talk about Imm Link, so let's dedicate a couple questions to that. So as I mentioned before, Imm Link's an add-on to the SNAP Health Center that users would purchase in addition to SNAP, and it allows nurses to link directly with the state registry, essentially reducing, could be a week's worth of work into minutes. So just before I ask the questions, I just have to show our attendees how easy this is to use. We get lots of questions about this. So basically it works like this. We've got the school nurse on the screen here, and all she has to do, she's got SNAP in the system, and it's pretty easy. Now on the screen, if you remember before, I said, remember that sync button, right, in the back of your mind. All they do is click that sync button. When that happens, she pushes it and SNAP immediately sends a request over to the state registry, the IIS, right? And then depending on the state, it could take minutes or seconds, very, very quick. But that state registry is going to send back immunization information directly back into each of the students' electronic health records in SNAP, making it easy and ready for the school nurse to check compliance for the entire school. It's really that easy to use. And then again, quickly, I just want to show right now our current availability status for Imm Link. So if you're looking at this and you quickly notice you're in one of the white states where it's not currently available, just keep in mind that this map changes quickly and that we're constantly working with each registry to identify when it will be ready for integration. So with that kind of prefaced, I just want to come back to our conversation, Terry, and I'm hoping that you could speak to some of the design aspects that you really key on key in on being essential for school nurses and how Imm Link is truly unique for our users. You know, and I'm thinking about those specific vaccine codes, some of the stuff that we already started talking about a little bit.
Yeah, sure. So what happens with Imm Link when you are syncing your vaccines, the sync from the registry is based on a code. So every vaccine out there has a specific code to it that identifies it, and those codes are assigned by the CDC. So when you're importing from the registry, it looks for the same code in your software, whether it be your student information system or your school EHR. In SNAP, we have the same codes that they have in the registry for every routine recommended vaccine for children. So whether it's required or not, because if they received it, it's going to come into SNAP. The thing with us is we have a list. So here you're seeing a list of our meningococcal vaccines and our so we have meningococcal B, we have meningococcal conjugate, we also have the polysaccharide. Many states require for meningococcal, if it's required, that the child receive one of the conjugate vaccines. If you have a system that's limited on the number of vaccines they have, typically what they'll do is they'll import from the registry, but they will sync them with a non-specified vaccine. So it might just say meningococcal. If that's the case, you are not really getting an accurate list of what the student actually received, and it could affect their compliance, because usually when they bring them into a non-specified, another good example is polio. There's the polio OPVs that are given in other countries that aren't counted towards polio vaccines in the United States. Those children could be marked compliant when in actuality they're not. So that's putting them at risk for a disease if they're exposed to it, because the accuracy of the vaccines that are coming in are not accurate, and therefore the compliance is not accurate. SNAP, like I said, brings in every ACIP recommended vaccine, as well as foreign vaccines that come in student records from other countries, like the MOPV, which is an oral polio, BOPV, which are not acceptable towards the polio vaccine, so that you will get true compliance for those students and thus decrease their risk for disease.
Great. That's an excellent explanation. Lots in there. And I know that we could probably talk on forever, but I do want to bring in our next panelist. So I really appreciate your time here, Terry. And we'd just like to kind of segue and introduce our next panelist, Ellen Carroll. Ellen is the current nurse manager for Roanoke City Schools in Virginia. She's been in her role since 2010 and currently oversees a team of about 28 nurses, and she can correct me if I'm wrong, across the city schools. Been a longtime user of SNAP, with the district implementing in about 2009, and is joining us today really to piggyback on what we talked about with Terry, but from the perspective of a school nurse. And for this part, I'd just like to turn our cameras on. And there you are. All right, Ellen. How you doing?
It's great. How are you?
Good to see you. Yeah, thanks for joining. So, so you've heard us talk about ways in which SNAP is designed to provide that high level of accuracy and immunization compliance, and designing it to save nurses time. And you've got a big team of nurses. You've been using SNAP for quite a while, and so maybe we could start. And I know we've had some good conversation up to this point, but I'd love to hear a little bit about what the compliance piece has meant for you and your team in terms of time savings and workload and such.
The time saving was massive. When I first heard that there was going to be an immunization link and it wasn't offered in our state yet, I actually called our state immunization system several times saying, hey, we need to get this going. And several times I called them. My nurses literally got up and did a happy dance when we were linked, when they came back to school that year, because we spend crazy amounts of time entering all the immunizations for our new students, our new kindergartners, new preschoolers, then of course the required immunizations for students who are going into 7th grade. It used to be 6th, now it's 7th. So I mean, it's just a massive amount of time that the nurses spent just inputting that data. that that link just saved us crazy amounts of time. So, and I just want to speak to the accuracy of it as well. Terry was speaking about, because it is always so accurate. You know, we have kids that we find that are non-compliant, you know, with what Virginia requires for them. And we reach out to their families. We send letters home letting them know. And they'll often go to the doctor's office, and the doctor's office says, no, you're fine. And they'll call us. We think they're fine. And we're the ones that are pointing out to the doctor's office that it's like, no, the spacing isn't correct on that, or this immunization was given prior to, you know, the minimum age for that. And we hear all the time, oh, yeah, you're right. You know, we just kind of count that, yes, they've had 3 Hep Bs, but don't really look at the spacing and, you know, things like that. So it is, you know, the doctor's office kind of listen to us now when we say that they're non-compliant. They believe.
Yeah, that's great. I mean, you know, at the end of the day, that's what it is, you know, and that's what we really try to pride ourselves on, is having that piece of software that's really working alongside you, that you can trust it too. You know, it's
right.
not just.
And we want our families to trust us.
Yeah.
We want families to know that when we say that you really do need this shot, we don't want to be sending them off to the health department or to their PCP if they really don't need something, you know. So we're always very careful, you know, to check, you know, before we send them off, and SNAP is 99.99% of the time correct.
Yeah. You were talking to me a little bit about, and we have a little bit of time here, so I could talk forever, right? But about some of the reporting features that you do. You know, you have 28 nurses or thereabouts with you, and could you just talk about how that works for you? It's a nice piece that we love, that we've built into
right.
time. Yeah.
Well, of course, it's so easy to run any sort of reports on SNAP. And we actually, each of my school nurses has a monthly report that they submit to me that it collects different data. We want to know how many sick visits they saw, how many injuries they saw, you know, a bunch of things for the entire month. But one of the things on there always is their immunization compliance. So they can run a statistical report and see what their compliance is for their school. So we do that for a couple of reasons. One, I end up running one for our entire district every month and reporting up to my superior. But it's also a little nudge for the nurses. They look every month and it's like, oh gosh, why is my, you know, whatever percentage not very good? Because it gives you a percentage when you do that statistical report. And then they can go in and realize that, oh my goodness, I've got, you know, 5 new kids at my school that I didn't even know were here yet. And they can start working on, you know, making sure those kids are compliant. So that's super helpful for them, just to run that report very quickly and see what and then, you know, once they do the statistical, then they can just run a report student specific of who is non-compliant and what immunizations they need.
Yeah, that's great. So it's like I feel like we're rushing through everyone, but a half hour goes fast, and so I just want to thank you so much for taking a little bit of time out of your afternoon to spend it with us.
Sure.
And we'll switch back the cameras off here as we move into a Q&A piece. And you know, I'd just like to quickly bring up a quick summary. Is, you know, so you've heard us talk about today how SNAP is designed for nurses by nurses. It's highly accurate by state, you know, to ensure that you've got high level of compliancy, and that's what allows us to make it accurate, right? With those rule sets, what we're building in behind for the time saving. And you've heard us speak a little bit about the robust reporting and communication features. So maybe with this, I'll turn it back over to Bill. We've got about 5 minutes left just to kind of see what our attendees have on their minds.
Absolutely, Mark. A lot of questions here. Some we're going to probably have to answer by email, but let's go through what we can. So, okay, here's one that I think would be good for Terry if she's still with us. Hi, Terry. In regards to Imm Link, if we purchase Imm Link, what will happen with all the data I've already entered in for immunizations? Will I lose it?
No, actually, you will not. Our Imm Link has been programmed so that it will look to see which vaccines the child has. And if, say, for example, you entered your diphtheria, your DTaP, polio, and Hep B as separate vaccines, but the child in actuality got a combination vaccine. So the registry is bringing in that combination vaccine. It finds the DTaP, Hep B, and IPV all with the exact same dates, and it will convert yours into the combination vaccine, removing those individual. Now, on the other hand, if the registry is sending in a non-specific vaccine and you have the specific one, we will retain the specific one because for calculation purposes, it's more accurate. And it will add that non-specified to allow you to verify which one is the correct, and then you can delete whichever one you don't want. So you will not lose your data. SNAP is smart enough to find the correct vaccines, rename them when necessary, or add when they shouldn't be renaming.
Great, thank you, Terry. Here's one specifically for Ellen. Hi, Ellen. I'm a nurse leader of similar sized district. How long did it take your nurses to learn how to use Imm Link?
So it literally took us about 5 minutes. So we have a staff development day when everybody comes back to school. We had a screen pulled up and SNAP on there, and we showed everybody. We kind of decided it was going to be simpler instead of doing your entire school at once to do just grade levels. So create a group process to allow syncing, and then hit the sync button, and boom, just like that, it happens. And the nurses, because literally to do a group, you click sync twice. You can go in and do each student at a time, but, especially when you've got your kindergartners, you just do your whole group. It was very easy. Even my technologically challenged nurses, it's very valuable to them, and so they caught on right away. Yeah, if I could, I'd just like to throw back to the previous question too. I know we are our immunization system, the information flows both ways where we are. So they actually pull into our state system the immunizations that our nurses have entered at the school. And this has been hugely helpful at the health department, because we used to get calls all the time that we've got students here for immunizations and we don't know what they need. We don't know what they've had because they have just moved to our state from other areas. So once we enter immunizations into SNAP and it links, it syncs up with the Imm Link, then the health department can actually see what that other child has had, even though they may not have a copy of that child's immunization record from another state.
Wonderful, thank you. And Mark, I have a couple people asking, how much does Imm Link cost?
So that's a great question. So the way it's structured, and this may not be the perfect answer, but we've got a one-time setup fee, and then what will happen is there's an annual user license fee. So the best way to find out what's going to work best for your school or the district is really just get a hold of me. You can get a hold of Bill as well, and we could kind of speak and find out a little bit about your school and what your needs are, and get you a quote that would be specific to you. But that would be, yeah.
Great. I think we have time for one more. Here's a good one. My IT team is swamped. Will this take up much of their time to set up?
Yeah, so the answer, Bill, is no time at all. So again, with Imm Link, they've got SNAP, right? So they've got SNAP, and our team really is handling all that behind the scenes. So their IT team has already done the work when they got SNAP set up in their systems, and there's no added burden for them.
Great. Thank you, Mark.